Hi everyone, welcome to 5 Minute Video Study for the NCE. Today we are going to be covering clinical focus, and we are in subcategory AF, which is sleeping habits as it relates to counseling. So as college students, did you all know that on average, college students are sleeping between 1 and 1.5 hours less than your previous generations? And then that's 60 to about 90 minutes of less sleep within one generation. So that's pretty significant. With sleeping, adults function on average around around 8 hours of sleep. So that's roughly the mean, but of course there are variables within that mean, and college students today are sleeping on average between 6 to about 6.5 hours of sleep. So that is below the mean quite significantly. That's an hour or two below. So 8 hours of sleep may seem unreasonable for many college students, but that does factor into daily living. Stress and anxiety can be factors, and many individuals, both college students as well as adults and children, can have trouble sleeping. So what are some of the symptoms? Sleep deprivations. What are some of the symptoms as well as the consequences? So we're talking about difficulty falling asleep, waking up frequently during the night, falling asleep at inappropriate times, even after a night of adequate sleep, sleeping too much, that's usually considered more than 9 hours, having sudden attacks of uncomfortable sleep or muscle weakness, having nightmares or night terrors, and then sleepwalking. Other things to consider when we're talking about the notion of sleeping habits is that sleep loss can be linked to depression. Some of the studies, 80% of people who suffer from depression also have difficulty sleeping. So, sleep problems persist after depression have subsidized, then the risk can increase. So again, there's links with different mental health conditions. So some of the tips to consider when working with clients, and if one of the goals is better sleep habits or better quality of sleep, some of the things to consider as a clinician is develop sleep rituals or sleep promoting bedtime routines. That might be, not using electronics before sleeping, slowing down, having a consistent routine where your body is, after time, is trained to kind of wind down. Another thing is to exercise or keep a routine of physical activities, such as brisk walking, swimming, jogging, or whatever exercise is most enjoyed, and that promotes restful sleep because you're physically working the body. So part of sleep dysregulation is many times the body doesn't know when to rest or when not to rest, and that the physical exercise trains the body to wear out physically. So then naturally it wants to rest. Some of the other suggestions are create a to-do list throughout the day, and that kind of keeps you on track instead of having your rumination or your mind worrying about some of the things. Also, the use of alcohol. Alcohol can disturb sleep, and really some other drugs as well. So monitoring that, avoiding large meals before going to bed. So having time to digest, taking short naps if you're not able to get the recommended hours, and then monitoring caffeine and nicotine intake, because again that's a stimuli which can affect the body's natural regulations.